Thank you, Tara, and thank you everyone again for joining us today. As Tara noted, today's session is going to be a Module 5 through 8 summary, part of our Data Beyond the Tip of the Iceberg series. Today's presenters is going to be Chris Copeland and Dr. Tony Salerno. So before we get started, we just did want to start with a poll question. As I said, this live webinar is a summary, and we do have modules kind of 1 through 8, as well as some tools that are available for download on our website. So we are curious to know if before tuning in today, if you have had the chance to view any of those materials. So Tara's going to post a poll and it is available now. We ask that you just take a second and fill that out, because that will just be some helpful context for us as we are going through the presentation today. I think we can close it out, Tara, whenever you think is appropriate. Great, so it seems like a few people have checked it out, and some have not. Okay, thank you so much, everyone. And with that, I'm going to pass it over to Chris and Tony.
Hi, good afternoon. Thanks for joining. Tony and I will be going through this presentation and swapping backwards and forwards through the slides, but pleased to welcome you to this. So today what we're going to be doing is doing a brief review of the matrix. I see some of you have seen that already, but for those of you who haven't, I'll take a brief look at it again. And then we're going to be talking about the data that's required to support sort of 4 levels of an agency: the leadership and how to in the decision making there, program management, supervisors and staff, and then we'll be looking at the next module. So let me just go to what we call in the data matrix to show you the overview of this, and then that will orient you to how we're going to be going through this presentation today. So the matrix is made up of 5 different areas of an agency. So we've got financial, human resources, staffing. We got data that's required around quality compliance, the population, the people that are being provided services to by the agency, and the outcomes that the agencies are striving for. And that data is needed in different ways by leadership of the agency, the department program management level of the agency, supervisors and staff. And the last 4 sessions have really been looking at in some detail the data that's needed in each of those areas, and looking at not only the data that's required, but the way that the data's needed, so people can, within the agency, make decisions at the correct level. And I suggest for those of you who have not looked at not heard the previous modules, that you can go back to those modules and see in detail some of the suggestions as to how and what data and how that data should be presented and used by people within the agency in those various areas. But today what we wanted to do was recap the past 4 modules and talk about the lessons learned and the big takeaways from each of those areas, rather than looking at the detailed data that we may find in each of those areas. So this is going to be an overview of leadership, departmental programming, supervisory and staff data. And we're going to take you through those areas and as I say, look at some of the lessons learned. So I'm going to turn it over to Tony now to talk about data and how do we make decisions. Tony?
Yeah, thanks so much, Chris, and welcome everyone. Chris, as I was watching and, looking over that matrix, I was asking myself, I've had a lot of different roles in my life, everywhere from being a staff person, being a supervisor, being a program director and manager, as well as being in a senior leadership position. And I had more information the higher I got. When I really think about it, I had more information when I was at a senior leadership, I had more data. Whereas as a staff, I had no data that would give me an idea of, in an aggregate, how I'm functioning, how I'm performing, how well my clients are doing. I didn't have any of that, nor was it being provided by anyone. So, when we don't have data, I think what happens is we got to make decisions based on other things, right? Now, sometimes it's going to be based on what regulation and licensing and credentialing and law says that you got to do this stuff, right? Whether there's data behind it or not. But oftentimes we ask people we trust. You got experts and consultants. Well, maybe they got the answer, right? Or we can go to the literature. Maybe science is going to be able to provide me at whatever level you are, whether you're a staff person or leadership, anywhere in between. Well, maybe researchers out there have taken a look at the very issues that I confront and deal with, and maybe they got some information to guide my decision making. Or maybe, look, I got trained in a certain way. I remember certain professors really stuck with me, and that's how I make decisions. Or, look, if it seems okay, nothing's broken, I guess that's fine. That was my position. If you asked me when I was running a day hospital, how are things going, Tony? And I'd say, well, pretty good. And they say, well, how do you know? Well, nothing bad's happened in the last couple of weeks. The staff seem to be showing up, and the clients seem to be showing up, and no one's got hurt or injured. And when I was running a day hospital, look, I felt pretty good that I had that sort of data, right? But we can certainly do a heck of a lot better than that, right? That's like a really law level. You can also be driven by your values and your experience, and we often make decisions based on that. Or what I think my team members will and colleagues will accept, or what my boss wants to hear. That's a big one, of course. Asking friends or family, maybe, finding out what my counterparts, what are they doing down the street in these other programs. Or I can attend webinars, right? And maybe I'll learn something. So this is all really about adding a component to decision making, which has to do with some hard facts. And that can be a really critical factor in ensuring that you're making the most informed decisions as possible. Next slide.
Oops, I moved it on too fast. Let's go back. Here we go.
Yeah. So for data to be useful, data is like oftentimes a bunch of numbers, but what one really needs is information. And you don't have information unless you understand the meaning behind that data. So you really do need the right data that's really specific, it's understandable. You can actually do something with it, right? You also have the right person who can interpret that data, analyze that data, and can generate some activities, some improvement activities based upon that data, or identify a problem, that we've uncovered. And if you don't uncover a problem, that problem persists and makes things worse. And then, when are we going to do this, right? Is the frequency, how timely it is, and how accessible and valid that information is. So these kind of there's some criteria for what makes data used. I've seen a lot of data, had a lot of data thrown at me, especially when I was in senior positions. And some of it, I had a clue what to do with it, and others, I was completely clueless about it. So these are certain critical things that need to be done so that you translate data into information, which then gets translated into action.
Yes, I think this is the sort of fundamental principle behind what we're trying to talk about here, is that the right data to the right person at the right time, and just maybe to, there's no point giving a program director the overall the financial data. It doesn't help to run a program knowing that only. So the right data at the right time is the key to all this, and it's sort of the fundamental, I think, thought to keep in mind as we work our way through this. So at an agency leadership level, data that's required there, really, so to keep in mind, this is often where most of the data is held in an agency. The leadership of an agency, as Tony said, often has a wealth of data around financial information, profit and loss statements, and balance sheet, et cetera, et cetera. This is all data that's often well known and is used to manage an agency. but it's important to balance fiscal data with what we term here program effectiveness data. So unless other data is available to manage the agency, it's often that the fiscal data is the one that drives decisions. And if we're looking at data in an agency that balances the financial data with data that's related to how the staff, how we're hiring staff, the quality of the staff, data that helps us understand the quality of the services we're providing, and whether we're managing to the high risk auditing that we need to do. Data that helps us understand the population of people we're serving and the outcomes of the agency. Unless that data is also available at an aggregate level at the agency, we're really not managing the agency in a balanced way. And as we look at the data matrix and think back to it, on the left-hand side, there was a lot of data that's financial and leadership oriented. But as we move towards the right-hand side and we're looking at leadership data around outcomes or the population, not only is that data often less available, it's also going to become more and more unique to your agency. Everybody has financial statements and balance sheets, but each agency's data that's around outcomes or the people you're serving is going to be unique to that agency. And I think it's really important that and Tony's going to talk a little bit more about this, I think it's really important that all the data that we see at an agency level, it's often rolled up from the programs that make up an agency, are connected directly to the mission. So the data that you're collecting and working on at an agency level really is about how the agency is meeting its mission. It's really where are we? Where are we as an agency? How do we steer the ship? And the data that we have at an agency level really should be geared towards that. And then back to you then, Tony.
Yeah, so some of these key decisions, really agency level data that sort of senior leadership needs, the board of directors, external stakeholders. These again agency-wide kind of like information, and based on certain critical metrics. This is really all about quality, and you can't improve quality unless you know what are some of the data behind those quality indicators. You know, sort of like effect. How do you know you're effective? So if you just ask yourself that question, right? How do we know that we're efficient? How do we know that we're safe? How do we know that we're engaging clients? How do we know that our services are being delivered that align with the felt need of clients? And it's all these kind of sort of critical questions. They're like, how do you know? And data is really part of critical in terms of answering that. It's also informed by data collected at those various programs, supervisory and staff level. So there's both, in a sense, it's a two-way street. The data has to flow in both directions. But at the lower you are, there's increasing support that folks need. You know, if you're at more of a direct staff level, and what would be my role if I'm just doing direct care? And do I collect data, and that the data that I share so that we know as a program how we're doing, and that also senior leadership as an agency, we know how we're doing with respect to any of these quality indicators. And then always, of course, balancing the fiscal with program effectiveness data. Sometimes it sometimes can seem like they're at odds with each other, but they really ought not to be at odds with each other. You know, the best way to ensure quality is just doing a really good job, right? And having the kind of data that really indicates that. And it's most useful when leadership, you know, has information about quality indicators that align with the overall mission of the agency. So these are sort of key decisions, questions to kind of ask yourself. Next slide.
Mm-hmm.
So the other key metrics, these should comprise like sort of a dashboard, you know, where you're actually looking at some of the critical things, making a decision of what's critical, what's pretty good, what would be nice, and what is, you know, that would be okay, but who cares? Making those decisions is really important. How often do we take a look at it? You know, problems can really fester. Poor performance can really just kind of be hidden in some ways unless one is really taking a hard look at some data. So ask yourself these questions. Have we identified the critical information that we need at every level to make timely and informed decisions, particularly at the agency level? Do you have a data collection system in place? Is it reliable? Is it accurate? Data is about as good as the way you collect it, right? How reliable, and is it really giving us the information we need so that if we did the same measure a week later, we might get something different? Reliable data, valid data is actually critical. Having data that isn't actually can be very harmful. Is the data organized and displayed in a way that's really meaningful? You get overwhelmed by just a bunch of numbers. So being able to tell a story with the data, and it can kind of inform you of what should we keep doing because this is really indicating we're doing well. What is it we need to stop doing because this kind of data suggests that there are certain practices or policies that are kind of messing us up. And what do we need to start doing that the data is suggesting that we haven't really attended to this issue and that we need to do that. So a lot of it is in really a simple way. Data tells us should we keep doing certain things, stop doing other things, and start doing some new things. And do we have data across all these categories, right, along the matrix? And which ones are empty? You can kind of take a look at that, right? If you were a team taking this seriously, if I had a copy of the matrix, one step I might take is let's go through it and let's circle the cells that we definitely have, we have that data. And then let's take a look at the cells where we ain't got that. And I think that could be an interesting thing. If you circle none of the cells, then, you could say, wow, we don't have an infrastructure here to collect any meaningful data at any level. Or, gee, we're okay at the management level, but oh my God, we got nothing at the staff level or supervisory level. So that's one way that the matrix can be sort of a mirror to what your current data collection systems look like. Next slide.
Oops, here we go. So the next slide would give us, I'm going to talk a little bit about data that's at a department and program management level. So we've talked about data at an agency level, and really the key to managing an agency effectively with data is having decided what those metrics are at that agency level. The only way to be able to manage at a program level or a supervisory or staff level is understanding how the performance and roles of staff and programs within the agency meet the overall key metrics of the agency in those different domains. So a key part of the agency is understanding where you are as an agency and where you want to go, setting key metrics, and then looking at the data needs of the department, the programs or departments that provide the data that roll up to the agency level. And we're purposely using program and department because data really should be available not just to maybe the traditional. We have data around how the programs are managed into either fiscal results or contractual results, but the department heads also have to have goals as well. So HR, IT, finance really all need to have clear goals in terms of what is their department, how does their department perform to meet the mission of the agency. So the data really need to be clearly designed for a department or program manager to meet the demands of their program. So these may be metrics that are around meeting contract deliverables or financial deliverables. And again, we're looking across the matrix to make sure that the metrics are balanced. So not only does a program have financial goals, they need to have goals in terms of recruitment and quality of the staff that they're working with. They need to have goals around auditing and quality standards within the program or the department. They need to have goals that measure how well they're doing in terms of the client population served and their part in the outcomes that the agencies are looking for. And just to mention the modules coming up, we're going to be hearing from ASTA Children's Services, who are going to be looking or talking about how they set up outcome goals for the agency, but based around program outcomes. So there's going to be, in a few weeks' time, there's going to be a presentation by ASTA as how they created outcome goals for their programs, which I think will be fascinating for us all to hear, because what they're able to do was recruit ideas from within the program as to how they can best demonstrate they're meeting their mission, set up metrics based on that, and then provide the data back to the programs so they could monitor the performance of the program itself. So we need to understand what the program manager actually needs as distinct from leadership and supervisors, because it's quite different. It can be quite a different set of data. Again, to use the sort of the easiest maybe example is the profit and loss statements. The profit and loss statements for a program need to be very specific to that program. They need to be highlighting the metrics that the program manager has to meet. So it's not people aren't overwhelmed by data, but there are clear metrics that they're aiming at in terms of maybe productivity, maybe key expenses. They see those profit and loss statements, but they also see key data that keys them in on their performance around some very distinct areas. So all that data for a program manager can be quite overwhelming. And there is a way of integrating all of that data. And the recommendation here is based around the sense that the program manager will be looking at data, complex data, but it can be quite overwhelming. So the recommendation here is that a way of dealing with an overwhelming amount of data is that somebody who is managing a program, which is sort of the key element of an agency, is supported by all of the programs, the administrative departments that support and provide that data to a program director. So a program director is going to be can be getting data from the finance team. They'll be getting data from their auditing staff. They'll be getting data in terms of hiring, recruitment, length of time to recruit, how long people are staying within that program, turnover rates, et cetera, All of those things interrelate and determine how well somebody can manage a program or how well their programs are performing. So it may be that a financial issue in a program is due to a high turnover or poor recruitment on behalf of HR. It may be something to do with IT not providing computer equipment in a timely way that enables staff to do their work. All that data interrelates and makes possible or impedes the ability for a program manager to run their program. So the recommendation here is that the data just doesn't come in a siloed way, but can be presented and work together as a team. So each of those departments that are responsible for providing data to the program manager to manage their program can meet together to try to problem solve, to try to create solutions that are supportive of the programs. Just to remind everybody, or just to say, underline again, that data is very useful, but it can be completely overwhelming unless it's dealt with and provided in a supportive manner. So integrating data within a business meeting that would take place on a monthly basis based around the timing of profit and loss statements, for instance, gives the ability for people to see, to receive the data, begin to understand what it means for their programs, and then work with the support of the administrative departments to help them manage that program. That will be integrating data and data use in action. So data for supervisors. I'm going to hand it back to Tony to talk about the types of and requirements for supervisors around data.
Thanks so much, Chris. But before we get to that, we've had some folks who were chatted in. And Stanley Capella, thanks so much, Stanley, for sharing some of your thoughts with us. And one thing that Stanley said is that he learned that we should never assume the stakeholders are interpreting the data the way you think they are, making sure that everyone is interpreting information the same way, also making sure everyone is defining things the same way. That's such an incredibly important point. Yeah. So I'm so pleased that you raised that, because you can have people looking at the same graph or information or data and coming up with different conclusions or interpreting it differently. or assuming it means a certain thing. So being very clear on what the data means so that everyone looking at it says, yeah, this is telling me the same story and not a different story, is really critically important. And I think following a lot of the information in these webinars and these modules can kind of help organizations to think about how do we present data in such a way that it's not going to have such great variability in terms of interpretation. The other point that Stanley makes is that when he's been involved in, program evaluation, which is using data, right, to kind of, identify how programs are performing and by extension, how people are performing, and that there's certain resistance around that. And that's absolutely the case when people are, when the expectation is, you're looking to see where we're screwing up. You're looking to see where we're not performing well. And no human responds positively to that, if that's the kind of culture or climate that exists. So one of the big challenges for leadership is to see data is not to just find problems. And if it is to find problems, that the point of it is to be able to provide more support, maybe more resources or efforts to try to improve that. And that it's a culture that we use data not to catch people or not to find problems or how to see performance difficulties, this more punitive type of thing, but creating a climate in which data is really used so that we can all benefit from that. Now, that really does take a lot of a vision around the use of data that is really meant to improve the experience of everyone, including the staff, the clients, and the organization. So those are really very, very important points that Stanley has mentioned. So I want to just thank you for sharing that and really invite others to share your comments with us as well.
And I think, Stanley, one of the benefits of those business meetings I referenced was twofold. One, to make sure that everybody understands the data in the same way, so there's no discussion about what the data means. And the other is that data really should not be, and those meetings can help with that. It shouldn't be editorialized. The data is the data. It doesn't necessarily mean anything specific. It is a set of information that needs a discussion and an understanding of what it means. And to use it in a punitive manner, as Tony mentioned, is a symptom of bad management and bad leadership, not bad data. And I think that needs to be culturally understood. And we'll get back to that a little bit as we talk about how we should use data and support staff with data needs. So thanks. That was really important. I'll move this on, Tony, so you can talk about supervision.
Sure. So, in terms of supervisor, now I've been a staff person, I've been a supervisor, I've been a director of a program, I've been in senior leadership. So, I've kind of, because I've been around like over 40 years. So, I've kind of gone through all these sorts of like levels. And I was just thinking about like, when I was a supervisor, that was, let me tell you, talk about, of all the roles that I've had, in many ways that always felt like maybe the most critical for me, where I was really that link between sort of organizational vision and mission and the actual work with direct care folks, really engaging clients and providing the service. And I kind of saw that as, out of all the roles, maybe one of the most critical. So really thinking about this role of a supervisor and the degree to which information and data would have been so useful to me. And I must tell you, when I was running clinics and the day hospital and things like, I had hardly any data. And I had to make decisions based upon sort of my own observations, anecdotal data, things that I would hear from my staff, from clients, and how useful it would have been if I had more of the type of data that is actually in that matrix level, at that supervisory level. So, part of my role as supervisor was the quality of the program, right? And to assess the overall quality of a program, for example, a day hospital, and, how is it, how are we doing, with our mission of helping people who are coming out of the state hospitals from, one, being able to be integrated into community and to reduce the likelihood of returning to the state hospital. And then I also had the role as I'm supervising people. And, there's data that I get just by observations, what people share with me. It isn't so much, it's qualitative data, right? In a way, it's qualitative data, but it's always, it's always kind of susceptible to a lot of misinterpretation, where staff see it one way, I see it another way, right? And most staff think that they believe that they are doing a super job, great job. But sometimes the data would show some inconsistencies there and maybe need for, additional support, maybe additional training, additional guidance, whatever it might be. So the direct supervision of people is one of the key roles. And also my job is typically to ensure that everyone I supervise is meeting certain standards around quality in terms of the services being provided, timeliness of the services, being able to address risk issues, being able to get back to people when they ask, a family member. I mean, I could just go down, and all of us could go down a whole list. And yet we often make decisions as supervisors without really having some comprehensive data on the performance of the people we supervise. Next slide. So when you look at high performance teams, and this actually has been studied, and I think about the teams that I supervise as well, and some of them were pretty good performing teams. Very high performance teams are pretty rare. That's what the literature tells us. That very high performing teams are just, you don't find them that often. You can find good teams, just not bad teams, but finding really super high charged, high performance teams, not that common. But what they do have is that they really, one of the things they focus on is the results. They focus on results. They have data to guide their decisions. They trust each other. They use data not to use as a cudgel against others, but as a way of answering the question, how are we doing? And what is it that we can do in order to improve quality and improve outcomes? Do we know? And you ask questions, right? Do we have the data about each person's contribution? Do we regularly review the goals and progress in a way that's really specific and measurable? Do we keep track of critically important, outcomes? Like, how do we know we're doing a good job? It may seem for our industry, a lot of times in the complexity of our work, it's sometimes hard to answer that question. In other industries, they have no problem answering that question, in terms of how we do it. Look at our stock prices, right? We've gone up 18% in the last year. We've increased our market share by 32%, right? Our dividends have been like 3.5% by quarter. I mean, there's industries that can say, given what our mission is, we know exactly if we're going in the right direction, if we're stuck, or we're going downhill. We have more challenges around that because it's human service. Our outcomes cannot be so clearly quantified. Although there are ways of using quantitative data in order to answer a question, are we helping clients kind of move in a direction that's increasing their success and satisfaction in their lives? Do we discuss performance data that we're really concerned about? So a very high performance teams, the issue of attending to results, holding each other accountable, and using data for both of those goals is an important element. Next slide. Data used by supervisor what the agency needs to monitor, right, in terms of productivity, and what a supervisor needs to monitor. And that has to do more at the each supervisee's job performance. Now, if the supervisor doesn't attend to agency-wide and supervisee-specific performance, it communicates really that it don't matter. It just doesn't matter. We'll be just more impressionistic. I rely on what you tell me. So, Joe, how are things going with your clients? Just great. Doing a really terrific job. I deserve a raise. Okay? That's one level of data, right? So if you look a little bit more closely, you may discover, I think Tony might be having some difficulties, with some of I noticed that his people, after intake, the number of people actually follow through with sessions, the time lag between the intake and when Tony actually sets up the appointment, because we don't use centralized scheduling, it seems to be quite a long time. Also kind of like notice that there's a lot of dropouts with clients that Tony is running. And the two groups he's running, hardly anybody shows up to it. It's mostly like 2 or 3 people at most. And Chris, his group, usually has like 8 or 9 people in it. So maybe there's something going on. Maybe there's ways of being able to help Tony so that he's able to really perform with the purpose of his increasing his own success and satisfaction. Okay, next, so the accountability. I made this point already. Next slide. And then one of my roles is to have uncomfortable conversations with some of my supervisees, right? And it's, sometimes a lot of it was my observations, the way the person behaved, my perceptions, my beliefs, which is fine. I have to, that's not inconsequential. So I would have conversations with supervisees, because I've had many of them over these past 40 years or so. And if I had actual data, which you can't really refute, I'd be in a much stronger position if I had an issue about that person's performance or that person's commitment really to the work. And in the absence of that, you get into, well, I said this, I see it this way. My supervisor said, well, I see it another way. And all you're left with is a lot of bad feeling. Right? So one of the other issues is, in order to hold folks accountable on one end, to help to improve their performance, is my role as a supervisor, which is to be a support and help, is data can often be very, very useful for me to use. And sometimes it's really to identify when it becomes a personnel issue, personnel matter. I can't tell you how many issues I had to face, especially with unionized workforce, in trying to address some issues when it was more impressionistic, when it was more like my sense of things, my observations, it becomes very tough. And then, so hard data is difficult to refute and dismiss. So that's an important issue as well. Next slide.
So thanks, Tony. And so the last few slides that we're going to be talking through are about data that staff need and use. I think this really comes back to the point that Stanley was making earlier on, is that all the data that Tony and we've talked about already is about what staff do, not how they do it. And I think it's important that we really are sensitive when we're looking at data at the staff level. And it's important that all staff need targets for their performance. If really all we do is focus on those staff who have very obvious fiscal performance measures, like productivity standards in clinics, then it to some extent it breeds resentment amongst that group. They're the only people that are being judged in terms of clear performance measures, and it really doesn't allow for other parts of the agency, and not just programs but also departments as well, to have clear goals. I mean, really, no matter where one fits into an organization, targets and goals should be a feature of the work life. And really, sometimes they only differ by a matter of detail. A CEO obviously will have clear goals based on the overall performance of the agency, and they may be, the balance sheet and how the agency is doing financially. But also, housekeeping should have goals around cleanliness of bathrooms, for instance, and it's important that both are critical to the success of the agency. And as I put here, I think some people would argue that the cleanliness of the bathrooms is a better indicator of how well an organization's run. But because both sets of data are important, they both deserve to have data available. It's unfair to somebody who needs to do a job and gets criticized for it if they don't know what their standards are. So it's important that all staff have data that's available for them to judge their goals by. As I said a moment ago, most of the data we've talked about so far is about what staff do, and it's less about how they do it. And in the human service industry, we know that a lot of the work we do is about be successful because of relationships, and relationships are not something that we can have ready data about. So the data we've talked about so far is in terms of financials, about productivity, census, human resources, the evaluation on job performances, documentations about audit results, and measures of program success, but based on outcome measures and clinical outcomes. And all that data can be very intimidating. It shines a light on staff performance, and data can alienate staff. So as we look across the matrix and think about data that staff, who, in terms of financial and performance evaluation, outcomes, and audit standards and quality standards, we need to make sure that that data is meaningful to staff, and it connects them from their work through to the mission of the agency. So in any way that we can involve staff in terms of defining what those goals are, I think we can be in a better position to be able to get buying and understanding around the job performance that somebody has and how that rolls up to the mission. I think that the data can help connect people's work directly to the mission of the agency. I think there's one of the quotes I love, which is probably apocryphal, but somebody was at NASA years ago, saw somebody pushing a broom and asked them what their job was, and their answer was to put somebody on the moon. So that connection between their work and the mission of the agency using data can be incredibly powerful. Taking a slight detour, I just want to talk a little bit about lessons from an article written by Atul Gawande in the New Yorker, and there's the link there. It was entitled Big Med, and the reason I'm bringing this up is that the work that staff do is something that's very difficult to have data around, but it's critical. And what this article has a lot of information in it, and one of the messages, and it's really only one of the messages from this article, is Atul Gawande is a surgeon, he's a writer, he's a thought leader in terms of the way healthcare should be provided. And one of his earlier articles was he was at the Cheesecake Factory with his family, and he began to be interested in how did the Cheesecake Factory always produce good value, high quality food across many, many locations and always managed to do it. Something that we struggle with as an industry really to be able to do is to have standardized high quality products. Healthcare in general is very difficult problem producing that over and over again. And what he found out was that for a line chef or a line cook, somebody who's on the front line of producing the food in the same way our staff are on the front line of producing, providing really high quality services, he found these three elements. There was very clear instructions as to what somebody should do. There was very clear indications of what the outcomes should be. There was very strong supervision in terms of looking at the work that was being done in terms of its output. But there was very little direction given to how somebody should prepare the food and how and their skill in how much salt to put on, the way that the food was basted, how often it was, how in the art of the cooking itself. So I think it's a lesson for us that we need to be able to give people clear instructions as to what the job should be. We need to have clear data on what the outcome should be, but the quality of the relationship in the middle is something that we need to allow staff the flexibility and the freedom to be able to use their skills to do that. But it's got to be surrounded by this important detailed data to make sure that we can produce what is the equivalent of a quality product. This is just going back to the original matrix. And what we've been trying to describe in the series so far is the need to have in each of these segments data that's available at different levels that is meaningful, actionable, and balanced in a way that the different aspects of the agency can be assessed, so you know where the agency is, how the programs are managing to their goals, how individual staff are being supervised and judging their own performance. And the tool, I hope, is available for you to look at along with the gap analysis tool to assess whether the data that you have is available and useful in all of those areas. Now, it may be that for most agencies and most agencies I've overworked in, data is not available in all these areas. But it gives you the ability to look where your data is, where it isn't, and begin to make some judgments as to where you want to prioritize providing data going forward. But to do that, there seems to me 3 or 4 important assessments and decisions to be made, and they're highlighted there in yellow. So under quality compliance, if an agency has not done a risk assessment to understand where their audits need to be, the data around auditings may be skewed. If the agency itself hasn't set quality standards, it's very difficult for staff to understand the quality of the work they're doing. If the agency hasn't decided on some clinical indicators that can be used across programs, then it's hard to judge individual client success. People who use the services of the agency and staff themselves, it's hard to know the progress people are making without the decision to use some clinical indicators. And I mean clinical in the broadest sense of the word. It doesn't have to be a formal treatment clinical indicator. It could be something that is very specific to your agency. And lastly, unless the agency has decided what the outcomes the agency is being judged by in terms of the ability to meet its mission, this may be use of emergency rooms. It may be ongoing abstinence for a substance abuse agency. But those key metrics around outcomes for an agency need to be decided before individual programs are able to assess their own success around outcomes. So these seem to be next slide for me. These seem to be 4 areas of assessment that need to be completed to make sure that you're able to complete your own assessment of the data available. And there's a simple risk assessment matrix here. I think Tony, you had an example. Sorry to put you on the spot, but you had an example of how you might look at a risk assessment here.
Yeah, I remember sharing that, with you. And let's just take a look at, let's see, the severity of harm and the likelihood. So I was thinking of maybe some folks, as we go through it, could think of something as well. Is if the severity is very high, but the likelihood is very low. Let's take COVID-19, what folks are kind of going through. If you were to think about how organizations and agencies are dealing with COVID-19, you would say, well, the issue of, let's say, bringing people back to the office, and you say, well, all right, let's assess the level of risk here. The severity of harm, well, could be pretty high. The likelihood, you can again talk about depending on which state or city or town you're in. Some might say, well, I think it's pretty low. We're in a rural area up in New York State, and really our incidence is less than 1%. So I would say the severity, is pretty serious. But now we have a little better medications. The hospitals are not overwhelmed. Again, you're going through this process of determining what's the severity here of harm if someone was to get sick. And maybe you might say, well, I think at this point, medium. In April, I would have given it a 5. And then what's the likelihood? Well, we practice some really, really strict, guidelines. We don't have that many lines. Our spaces really accommodates distance and all that. And you may judge that the likelihood might be medium or low. And you kind of you have to sort of consider both things, the severity of possible negative outcomes and its likelihood of happening. And that's just one example. And I think you can apply that process to many other risk issues around psychiatric relapse was one. The issue of not getting medical care might be another. And you can probably go down the list. Suicide, kind of like risks. So you can kind of go down the list of the kind of typical issues that folks would address and then make some determinations based upon severity, the intersection of severity and likelihood.
Yeah, so if one uses a matrix like this to look at activities of an agency, those that end up being high risk, a high likelihood, are the ones that should be audited for on a more regular basis. Another example for a Medicaid program would be a program that bills on a monthly basis and needs a medical authorization. Without that, the payback to Medicaid is very high. So the severity of harm is very high, and the likelihood is, for a lot of us, will be medium. It's not uncommon for that authorization to be not in place. So it's something that should be audited on a regular basis, whereas other things could be quite low and don't need to be audited. So this is just and there are many tools that are available on the internet that give you an idea about these risk assessments for compliance. So an important element, along with deciding what the clinical assessment tools you should be using, what the quality standards are, and what the agency outcomes should be for your particular agency. So data metrics can be developed and data can be found to support that. So that's sort of the recap of the last 4 sessions, and the next 3 modules are really going to be demonstrations from a couple of agencies that have managed to create metrics and data that support the work they're doing. And I think the first 2 are really going to be looking at, for the data champions, are going to be looking at the data available around productivity and standards that clinicians need to meet within clinics. And then, I think I mentioned earlier on, outcomes, developing specific outcomes for programs. So again, metrics can be developed, data can be found, and programs can be much more cognizant of their progress towards the outcomes. And similarly with Module 11, we'll have another agency talking about how they developed outcomes to monitor the health of people living in residential programs, and how we can change their health outcomes by having that data available and changing the way that staff react to the health needs. So there's a couple of questions. Andy, does the risk assessment matrix, is there a score that is calculated? Yeah, I mean, I think if I just go back to the matrix, I think I understand your question. That score is, you would then attribute a level of auditing to scores that score 5, those that score 4, or those that score 3. I think it's a way of looking at when that risk assessment is complete, where does the auditing team or the compliance team need to focus their attention. I think it's also important that staff understand that they're in a high-risk program as well, so they understand why the focus of an auditing team may be higher on their program than another. So yes, the score in there, I think, is an arbitrary score being placed in those cells to give you an idea as to where to focus the auditing and quality assurance. And then Paddy Abelson asks, does anyone have an idea about a metric for engagement? We are thinking lack of engagement is a risk factor. The question is how to measure. I don't have an answer other than I think it's clear when you look at the engagement rate for one staff over another, there's going to be a difference. So from a staff point of view, the number of kept appointments for one staff over the other is going to be a gauge of that engagement. Somebody has a lot of turnover in clients, versus somebody else who has a higher rate of engagement. So the number of people they do assessments for and the number of people who complete 5, 6, 7, or 8 sessions is going to be different for different staff. And I think some staff create a greater risk for people who don't engage. So it could either be done on a staff level or it could be done on a client level, because it may be that if we're talking about a clinic, the clinic doesn't engage younger gay men in the same way that it engages older women, for instance. I'm making those two groups up, but there may be some patterns within the data around the number of sessions people keep, and the demographics of those groups could give you a key to the risk factors that you may have within the client engagement. And you may also see risk factors within one staff over the other being able to engage better than another. So I hope those are some answers to the questions you've given. If not, please follow up with us. And here's the email to follow up with, and we can follow up in more detail.